So in epidemiology, we were taught the tuberculosis numbers came down as Singapore became more and more developed. And at the same time, the use of computers were going up. So it meant the use of computers led to the fall in tuberculosis. Perfect, isn't it? So all kids should play more computer games. Mom, tell that to Mom. The answer is of course not.
Hello everyone and welcome to today's episode for Medical Channel Asia's podcast. So today we have with us a very special guest, Dr. Leong Hoe. I think everybody knows who he is, and he is actually, I feel like everybody knows him from the time when we were talking about COVID and there's a lot of things going on, and he's always been out here talking to us and educating us all about the important things that we need to know when it comes to infectious diseases. So today we'll be here and we'll be learning a lot more from him. Hello, Dr. Leong.
Hi, I hope I can share something interesting and we'll talk about something other than, my God, not COVID again. Okay, we'll do something fun and exciting this time round. And if you find this interesting and you want us to talk more about it, you have an interesting topic, please bring it up, host, let us know, and then we'll see if we can make another program again.
Okay, so to start first, maybe you can share with us about your journey. How was your journey of becoming one of the most famous infectious disease specialists in Singapore?
I think she's trying to make me puke. Okay, I wouldn't say I'm the most famous, please. Rather, the circumstances allowed me to explain what COVID was to many people. I appreciate the opportunity. And then if anybody was asked to do the task, I think they've done the same. So I became a doctor simply because of my natural progression. After junior college, I did triple science. At that point in time, we were allowed to do triple science and one math. Then the most natural thing to apply for was medicine. I was in army, and all you had to do was just go through army. And when the opportunity came along, I just applied for medicine, and medicine was given to me. So I wasn't in particularly dying to do medicine, but it was just an opportunity. I took it. I managed to do the interview, which I think is a farce. The interview is a farce for those people who failed to get into medical school, because you failed the interview, it doesn't tell you anything about a character. In fact, I know of many excellent doctors who failed the medical interview, but they were fabulous doctors. So going forwards, then it went on to become a medical doctor. I was more interested in non-surgical stuff, so I focused on medical practice. Among medical practice, I had the choice of endocrinology or infectious diseases, but fate had me choose infectious diseases.
What's the point where you get to choose? I think many people, some of them, they will think, I want to grow up to be a certain specialty, but at what point do you choose and what made you choose it?
So the first thing is, after medical school, you decide to go on a specialist training, you do general medicine. As you do general medicine, you rotate through the different disciplines and you find something which you have an inclination for. So for me, narrowed down to endocrinology or infectious diseases, kind of different. But at the end of the day, the opening was for infectious disease, so I jumped on it. And it was good because there were so many opportunities for learning the new diseases every day. Yes, indeed, there are new viruses every day. Can you imagine that? And then, of course, there's vaccinations and COVID. It appeared as if I fit nicely into infectious disease like a pair of gloves.
So maybe, going into infectious disease, and there's always so many new things, right? Was there any particular case when you were new that came out or jumped out to you that really maybe left a really big impression on you?
I think there were many, many such cases. So infectious diseases is rather a jack of all trades, master of none. If you ask a cardiologist, they really can tell you a lot of things about the heart. But if you actually do an orthopedic surgeon, they'll tell you many things about the bones. But in the case of infectious diseases, you can have infections from the scalp and the hair right down to the toes on your feet. So you must know a little bit of all different things. Number two, infectious diseases, germs can spread all over the body. So you can have infection on the bones coming from the heart, or in a heart infection going to the joints. And obviously Marie is nodding because she remembers all the cases in the past where she saw them. So it is a very multi-systemic discipline. Kidney failures, liver failures, and all this from infection. So we become a bit of jack of all trades. We're not exactly very smart people, master of none.
You know that's not true, right?
So one of the challenges that really excited me very, very much as infectious disease specialist is we often see patients which have a very complicated story. Multi-system gets involved, and you get many teams of doctors coming in to try to help the patient. They get a bit frustrated, they get a bit exasperated because nothing seems to work. So they call the infectious diseases doctor, and my sifu, I'm going to pay tribute to him, Professor Tan Ban Hao from SGH, who's known to be so detailed, so careful. He has such a great eyeball of cases, will come in, look through the whole file, spend easily 1-2 hours, and come up with a mighty pen and wrote, the diagnosis is this. Please do the following confirmatory tests. That was so inspiring. So indeed, we have many other such situations, and one of the very interesting cases which I saw recently was just before the weekend, was a man who came in with calf pain. His muscles were aching.
That's so general, right?
General, right? Yeah, precisely. His muscle enzymes was beyond measure. The biochemistry says more than 39,000. Don't ask me to break it down. So his muscles were breaking down, and when you looked at him, his eyes has a tinge of yellow.
Sounds some liver
disease.
Jaundice.
Absolutely. Then if you look carefully, it's a little bit red at the same time.
in his eyes.
In the eye. So it's a bit of conjunctivitis. Then you do the blood test. It shows that his kidneys are out of sorts. Not in kidney failure yet, but out of sorts. So was his liver. So we have a liver, kidney problem affecting muscle. So it's a hepatorenal syndrome with jaundice as red eyes and calf pain. No, rhabdo would be the complication. Just very quickly, for those people who love spinning, spinning actually can cause rhabdomyolysis. You break down a lot of muscles, but in this case, it was caused by an infection. It's called leptospirosis. Leptospirosis is actually rat's urine.
What?
Tapped on rat's urine somewhere.
Okay.
And with that, he picked it up. And his size, well, he was more like 80 to 100 kilograms. He certainly wasn't spinning. So he ended leptospirosis. We gave one drug, penicillin. 24 to 40 hours later, it was much better. He's improving as we speak. So these are the wonderful, fancy diagnoses there is. Now, just a quick detailed discussion on leptospirosis. It's almost like a disease of the third world countries, but no, there is leptospirosis. You find them in the drains, you find them in wet markets. You go to the wet market, I go to the wet market, but I never wear flip-flops. Because the flip-flops, you'll be exposed to the water, there'll be little cuts on the skin and go inside. Then you say, well, Dr. Leong, I'm very smart. I don't step on rat's urine. But do you know that the rat's urine the bacteria can survive on the soil 6 months? 6 months after he peed. Okay, step on it, you still gonna, and that's how he got it. So that was one case. And where was his risk? He actually goes to the storehouses, and then that's where you find rats. So similarly, if you are a storeman, you go to the stores, you can be exposed. You go to the wet markets, you have flip-flops, you play in the drains. Okay, how many of people of my age, come on, we grew up playing in the drains, remember? Catch guppies, remember?
Guess we're safe.
So we did all that, and we would have exposed ourselves to it. So, but that's very, very interesting, something out of sorts. And when the doctors see it, they find it so exciting.
Actually, I'm curious, right? Do these cases go straight to you, or do they go through like a GP and then they don't know, they think it's a infectious disease and they go to you, or does it somehow go to maybe, let's say, like a sports person because they think that it's a muscle issue, and then after that they go to like a kidney specialist because they think it's a kidney issue, or how does it come to you? Or
Okay, so it's a little bit different between the restructured hospitals and the private. In the private, they tend to come to us because there'll be undefined fever with calf pain, and they tend to come to us. In the restructured hospital, you go under the general medicine. In general medicine, the team will try to work it out to see if it's a kidney problem, a liver problem. At the end of the day, they get a little bit stuck. Something's not quite right. It's something beyond the usual liver kidney infection. Then they call in the infectious diseases.
it's really going to take a long time before they actually get the help they need, right?
Yes, unfortunately, it does take a little bit of.
Then for a case like this, do you think that he would have deteriorated a lot if it took much longer, maybe 2 days, 3 days?
Potentially. So one of the most dramatic leptospirosis I saw was actually an American who went to Indonesia jungles. She's not exactly trained to be climbing hills and whatnot. So she's a little bit on the rounder side. So she went up the slopes, down the slopes, she fell many, many times, and she was not equipped for that. They were looking for small little mammals of this size. They were very adorable. I can't remember what they're called. So at the end of the day, in Indonesia, she was admitted to hospital. She went to liver failure, kidney failure. The insurance say evacuate her to the next medical center of excellence. This came out to be in Singapore. So came us to us. She was in full frank kidney failure. She was dying. I'm not mincing my words. She was dying. So we quickly made the diagnosis, started the medicine, and she snapped out of it.
Snapped out.
She snapped
So
out of
she's
it.
like,
Well,
okay.
well, she did recover. The kidneys took a few months later before she recovered. But she sent me an email a few years down the road and said, I'm well, and she was still very grateful to me for making such a diagnosis. So very dramatic, extreme ends. You save the patient, get the patient better. Indeed, that is really rewarding.
It's really challenging as well.
It is.
So besides maybe something of such a dramatic improvement, right? I mean, of course, I think many people also like to know the bad sides of infectious diseases, maybe something that took a long time to heal, or maybe something that is actually very complicated to treat, because that sounded like there was this miracle drug that could solve or cure this person, right? So there's definitely going to be cases where it's very difficult to treat, or many lines of treatments have been tried and failed. So do you have something interesting to share on that end?
It is typical Marie. Try to throw a cold blanket at me. The answer is yes. There have been so many patients which we lost due to infectious diseases. Do you know that many people end up with cancers, but the terminal event is actually an infection? So it could be a pneumonia infection or blood infection because of chemotherapy or because of the weakened immune state. The body will just fail. And at the end of the day, the infection overwhelms the individual. So unfortunately, infectious disease is the terminating event for many people. So when we are down to the situation where there are many bacteria that's become multi-resistant and we can't get rid of them, we don't have antibiotics. Or if we do, the antibiotics don't work well. It's almost like trying to smash a stone with eggs. Once in a while, you're fortunate, but majority of the time, you're not. But those are serious infections. Number two, some of these patients are so sick, you can't control what you say, source control. You can't go to the site of the infection and clear it altogether. So instead of trying to blast my way in to kill the germ, you put in a drain to suck it all out. But to put that drain in may kill the individual.
Mm. So you're just kind of managing it around the side.
Correct. So we're managing, give antibiotics. But at the end of the day, well, we can't cure everything. If we cured everything, even our dear beloved Mr. Lee Kuan Yew would still be alive at this stage. Remember, he died of pneumonia at the end of the day.
There was a very solemn turn, but that's all right. I think it's just as healthcare professionals, that's what we see, right? We see patients get better, and then we also see patients who don't manage to make it. But we are always trying our best to make it such that our patients are getting the care that they need.
Indeed, we try to comfort all the time, and we try to be there all the time. But at the end of the day, our ability to cure is actually very few. But nonetheless, if you, as a doctor, I've come to realize it's not so much about the treatment, but the process of getting the person well, speaking to the individual, walking with them, journeying with them. In fact, I had one man who died recently about 3 to 4 weeks ago. A lovely man who actually has end-stage Parkinson's disease. His Parkinson's disease was severe, and then whatever he tries to swallow, the food or the saliva, his own saliva, falls into the airway. So he keeps getting pneumonia. So comes to me for pneumonia. So we treated it. We tried to help him along. I say, sir, it looks like I can't really get on top of it. I need to put a tube in so as to give you the energy and then perhaps try to minimize the swallowing. Can you imagine? He's hungry. He wants to eat. But the very fact of eating will cause a pneumonia because it drools inside. So in the end, we got the tube in, got him a little bit better. But then the infection started to get the better of him. And he said, Dr. Leong, thank you very much. But I will not live with a tube in my nose. I will not live with a feeding tube in my stomach. You have done the best for me. That's good enough. In fact, it's time for me to go. So with that understanding, we took off the tube, got him comfortable, had the palliative care come in, and then make sure that he was given his favorite foods. I'm one of those who insists on eating my favorite foods even on my last day. Okay? So he went home a couple of weeks. He spent time with the family. All the family members were all around. He eventually had his last breath. They were weak towards the last few days, and he passed on. He passed on the way he wanted. He dictated the circumstances. No tube feeding with my family. I mean, honestly, that's a joyful, dignified death. So we get the chance to walk this, and honestly, it is an incredible honor, privilege to walk with him. And he lives in my heart. He may have passed on, but there's a little space in my heart for him all the time.
So, Dr. Leong, other than the cases that you shared earlier on, have you been seeing any cases like getting more and more common in Singapore lately?
Indeed. Did you realize that we had our travel revenge? The infections had infection revenge as well. So you probably realized that at the beginning of 2023, we had a lot of cough, upper respiratory tract infection.
Everyone stopped wearing their mask.
Everyone stopped their mask. Okay, everyone was hugging, eating, feasting, and in turn, the viruses were feasting on us. So there was a lot of influenza initially, and towards the end of last year, we had COVID. COVID is still around. In fact, my aunt was just diagnosed with COVID this morning again. Yeah, again, because it's a fourth or fifth attack.
Whoa.
Okay, she being my aunt, she could actually go for the antiviral agents, that is Paxlovid and Molnupiravir around. Now, but what's circulating now? This being towards the end of March, the circulating viruses are two. Well, influenza is number one. It takes up about 50-60% of the cases. So influenza, we actually have medications for it. So if you diagnose it, you should actually take anti-influenza medicine. There's also a vaccine for it. Number two, another thing that's a little bit more interesting is Mycoplasma. Mycoplasma, and we're seeing it happening a lot too.
Actually, before we get into Mycoplasma, which I know is a really hot topic right now, I just want to touch in a little bit on influenza, because I think many people think that influenza is just the flu, right? And it's something that they can treat, or it can just go away on its own. But you said to treat it with antivirals. Do you think it should be something that everybody gets? Like, if they were to come down with the flu, they must go see a doctor, they must go and check it's a viral infection, and then they must go and get an antiviral. Would that be something that you recommend? Okay,
first of all, I want to correct the word flu is abused and misused all the time.
We know.
When you say the word flu, everyone thinks I got the runny nose, I got a blocked nose. It's not. Flu means influenza. That means you know you have the influenza. But many people use it loosely. So that's wrong. Don't use flu anymore as runny nose. I've got the runny nose, I've got the blocked nose, I have a cough, I have a sore throat. So influenza is one of the major problems of upper respiratory tract infections because they do cause severe disease, especially in the young and the elderly. They cause secondary bacterial infections, but it is also very, very common. It's preventable with vaccines, and when the flu does happen and you do show that the flu test is positive, you should start the anti-influenza medicine for two reasons. Number one,
Spreading to other people.
oh, actually, there'll be the third reason. So you can reduce down the spread. Very good, Marie. You can reduce down the spread. Number two, your symptoms resolve faster,
How much faster?
at least by 1 to 2 days.
Because usually, I mean, if you are someone that is a pretty strong constitution, I don't think you will be down with the flu for too long, right?
Yeah, you're right. You're right. But if you're like your boss and he earns $10,000 a day, not working for 2 or 3 days, it's a lot of money.
That's true.
Can you imagine Elon Musk or Jensen Huang not working for 1 day? That's a, or just the prime ministers or the cabinet ministers. Okay, that's number one. Or this happening during exams. Number two, the second reason is you can prevent future complications, especially for the young and the very old. So I like taking the medications. The medications weren't as costly as they were before. You can pick them up from the polyclinics.
Tamiflu.
Yeah, Tamiflu. It's gone generic. Different companies are making them. So it's actually worthwhile taking it. And I mean, I'm a parent of 3 children. If they have 1 day less of symptoms, know what I say? Hallelujah. Okay.
Just take.
Just take. Okay, so get them out of the system, get their illness out. Well, my life is easier.
Okay, so Dr. Leong, just now you mentioned about Mycoplasma infections. Can you tell us more about this?
Mycoplasma infection, and I'm going to share with you some tips that's available only on this podcast.
Only on this
Whoa.
podcast.
Okay, first of
Really?
all, do you remember in November, December, there were a lot of reports of a funny infection in China. There were people, WHO was asking China, and so were the rest of the country, do you have another COVID? Is there a COVID 23, 24, etc.? At the end of the day, China said, no, it's just an ordinary cold virus. But as it turns out, time and time, it became more obvious that it was actually Mycoplasma infection, or they also call it 支原体细菌. Okay, so Mycoplasma is a bacteria without a wall, so it's actually quite hard to grow it. You can, but with great difficulty. But nowadays, we use PCR, the very same way we do the COVID swab test. We use the PCR for testing, and we have means of diagnosing on PCR in 3 hours.
That's fast.
Now, some of you may say, oh, I've had Mycoplasma in the past. That was with the blood test. The blood test is not a good test because it tells you that you have antibodies to the Mycoplasma, but it doesn't mean that your Mycoplasma infection is now. It
So
could have been
previous
3
infection.
months ago, 3 years ago. In fact, if you were to do the blood test for Mycoplasma, studies have shown it's accurate only for 60%.
That's
Now,
not very accurate.
it isn't. So would you put your life on the line with a test that's only 60%? No, you
Guess no.
wouldn't. You wouldn't. So you really want the diagnostic test, don't go for the blood, but you need to do the swab. So this is tip number 1. Tip number 1, only available on this program, is if you want to have a good swab test result for Mycoplasma, you have to do it not just deep in the nose, but you have to do a throat swab at the same time.
At the same time.
At
with the same-
time. Well, no, I think it's a bit disgusting. I mean, look at Marie. Oh my God, what's wrong with you?
Eco-friendly.
Okay, so this is one of the times where you actually use another plastic swab. Yes, it is plastic. You do one deep into the back of the nose and the other one back at the throat. Now, if you were to do the dip of the nose, you don't need to do it for 15 seconds. That's a silly idea. Swab it deep, come out, you can be in and out in 1 second, do a throat swab right at the back. The answer is Mycoplasma lives better at the lower part of the throat. You want the money? Go to where the money is, which is lower part of the throat. So you do the two, You get 2 tests for the price of 1. Tip number 1. So the test will come out positive and the Mycoplasma will show up positive, and this is where the problem comes in. Up until June or July last year, the Mycoplasma in Singapore, 85 to 90% will respond to the usual drugs such as clarithromycin or azithromycin. But when China had their outbreaks, we had already known China for the last 4 to 5 years had drug-resistant Mycoplasma. The previous reports in about 2016, 2018 say 85-90% of them were resistant to clarithromycin and azithromycin.
Already resistant.
Yes.
Okay.
So a report was published in 2014 and say when with this latest outbreak, 100% were resistant to clarithromycin and azithromycin.
So what to do now?
What to do precisely? So it boils down to 2 drugs which you can use. One is called the levofloxacin. The other one is called doxycycline. I'm going to repeat it again. Levofloxacin. Second one is doxycycline. Now, I would prescribe levofloxacin freely to the adults. No issues at all. Same for doxycycline. But levofloxacin in children's use, well, it's controversial. It is associated sometimes with joint problems because levofloxacin acts on the cartilage and you may have some joint pains thereafter. So there's always this fear as you use levofloxacin, you affect the developing joints. So people don't like to use it and you use it only when you have to. So CDC and WHO has come forward and say if you need to use it as a life-saving drug, please go ahead. So levofloxacin has its problems. Doxycycline, on the other hand, causes staining of teeth. The teeth will turn a little bit of yellow, and that's a bit of a concern. So the counter-argument is...
they have really clear skin.
Well, rather, they have milk teeth.
Oh, right. Then
So
you'll
if
just
the
drop
milk
off.
teeth just drop off, not a big deal. But if you've already dropped off your milk teeth, then it may be a slight problem. But in truth, both of these drugs develop problems only when you use it long term. So I do have patients who develop joint pains at about day 5 to day 7 of illness, but hey, I don't need any more of the medicine. So by the time I complete my course is when the complications happen, we stop. So all the other patients have been fine with it. Doxycycline, you need to build up the drug inside the system, inside the teeth. So 5 to 7 days doesn't work. In contrast, if you don't do it, what happens? The child will be suffering with fever and cough. Fever and cough miserable for the next 5 to 7 days. So a lot of pediatricians have a lot of caution in using this drug. But I think it is rather the situation that, number 1, we need to make the right diagnosis with the right test. First tip from this podcast. Second tip is be aware of the complications of the drug. Watch out for the complications of the drug. If it happens, then you stop the drug.
So
Then
for
you'll
this
be fine.
mycoplasma infection, was it specifically only happening to children? Was it like circulating in the kindergartens or something
A
like
lot of children have an infection from it. A lot of the adults are not falling sick with it because they have previous exposure. So they kind of know how to fight it. So when they're challenged with it, there's some immunity.
But then again, for the mycoplasma, it sounds like very non-specific symptoms also. It's like fever and cough, right? Does it go in its own? Does it get complicated over time?
Great question. Okay, so to finish up, yes, I do have adults falling sick with mycoplasma as well. And you would need, again, I will use a levofloxacin quite freely. Now, for the majority of the mycoplasma, in fact, half of them or more will recover on their own.
Okay.
They don't need any specific treatment. They may have a fever and cough, they will. But the other half, they may actually need an antibiotic to help them along.
So it all depends on the symptoms. How severe is it for them to depends whether they should seek for treatment.
Spot on. So I am not advocating levofloxacin, doxycycline for everyone. If your fever is not going away or there's evidence of a pneumonia and the child is clearly not doing well, please start it get the kid well, get back to normal life.
All right, so you spoke about some of the more common infections that come in. And then I think something that has always been around, but I personally, I feel like, okay, so what we're talking about is tuberculosis, right? Personally, I always thought of tuberculosis as something that it's more, it's not something that happens to first world countries. I don't know whether that was like, I was uninformed or anything, but it just felt like it wasn't really a condition that happened to first world countries because it was something that sounded like it only happened to places that were less developed. So how is the situation of tuberculosis like in Singapore?
Okay, first of all, I'm going to share with you a little funny joke. So in epidemiology, we were taught the tuberculosis numbers came down as Singapore became more and more developed. And at the same time, the use of computers were going up. So it meant the use of computers led to the fall in tuberculosis. Perfect, isn't it? So all kids should play more computer games. Mom, tell that to mom. The answer is of course not. Tuberculosis came down simply because people had better living conditions. People are living further, hygiene-wise, no longer kapui and then it ends up and the spit on the floor, on the drain, etc. So all this helps. So the better living, the better education, the self-awareness, health matters and things, got things better. So tuberculosis, first of all, it is still haunting us. It haunts us because tuberculosis can reside inside your body for a long time. You could be exposed as soon as 3 months of age, and it can show up 3 months before you die. So it is really the extreme of ages. So if I have ever been exposed to tuberculosis, guess what? In my lifetime risk is only 10%.
That anything will ever actually happen to you.
1 in 10 will actually show up. But if I have diabetes, it goes up in 3 in 10, which is 30%. If I have HIV, God forbid, or or something immunocompromising situation, I might be using a lot of steroids, a kidney transplants, using some medicine, autoimmune, etc., where it goes up to 60, 70%. So it's a function of your immunity. So, but mind you, Singaporeans are living longer, and the day is really possible that you, the audience, and the two lovely ladies here will be cursed to live until 120 years old.
That's not a curse.
Okay,
I don't know.
Okay. When you're 90 years old, 100 years old, and when you can barely walk, you might say,
another 30 years to go.
Another 30 years
there,
to go,
yeah.
yeah. Okay, so we can look at it either way. So tuberculosis is one. So Singapore, if you look at the general population, you take the blood, we have a blood test to show you've been ever exposed before. It's about 26 to 29% of the people would have been exposed to tuberculosis. This can be in the past, or recent past, or distant past, and 10% of the time it will show up. Number 2, how does it spread? Situations like this. Okay. Now, Marie's a bit smarter because she's sitting on the side, but you're right in my face. My exuberance in my speech will send droplets flying to you. But in fact, it travels by air. And WHO said you need to have 6 hours of close contact. So there's a typical household family. But if you think about it, the right cough, the right droplet at the right time may actually pass an infection to you.
So it doesn't even matter whether it's 6 hours.
or not.
Yeah.
So it's a little bit of a luck of the draw. So eventually, tuberculosis may show up. If it shows up, you may have fever or you have no symptoms at all. Fever, cough, loss of appetite, loss of weight. And I can tell you, many people go for this routine
the chest
pre-work
X-ray.
and they pick up tuberculosis. Okay, and then when you do pick up tuberculosis, guess what? Not only could be you, but your family member may have it as well. So once you find one, you need to quickly find the other. Now, Singapore is really trying very hard to eliminate tuberculosis.
Since when? Like,
in the last few years. You notice the Jalan Besar story?
Oh, yeah, no.
They were going out to the field, taking bloods from thousands
Everybody.
of people. Know how much resources and money there is? It tells you, the Ministry of Health says, I'm determined to exterminate tuberculosis.
But you're saying that 26% of people would have been exposed to tuberculosis at some point.
Correct.
So if they go out and do all these tests, they will still find about 26% of these people.
Correct.
So how would you know which one is the one that feed from that particular Jalan Besar case? How would they know?
You can't. You really can't unless you actually pick up tuberculosis in them. So when they did the numbers, I remember it was only 10% of the population they screened actually had tuberculosis previously. That means the blood test was positive.
Only spreads if you're symptomatic, or it can spread even
Like
later.
latent TB.
Yeah, latent TB.
Okay. So tuberculosis, she touched on something very good. Tuberculosis can be latent or active. Latent, that means sleeping, not waking up yet, not spreading, not active. So they can't spread. On the
Like
case
even
of-
no symptoms, right?
even no symptoms. Active, they may and may not have symptoms and they will be spreading. But the only way they can spread is through the lungs. If I have lung tuberculosis and it's active, then I'll be spreading. But if I have tuberculosis in my gut, I've seen tuberculosis in the nails. Can you believe this? Nails.
How do you even see it? How do you even see it?
It's not common.
It's really very,
Very
rare.
rare.
And you have it on the scalp as well. So the nail one was, he actually had the funny discharge coming out from the nail. The nail looks infected. They took it out and sent for culture because it looks so weird. And then it
It
grew out
gave you-
tuberculosis.
Oh my god. I can't even imagine coming out of it.
Nail, right? It's so weird. Okay, so if you have it in the gut, if you have it in the gut, you have it in the kidney, unless you are drinking my pee or eating my shit, you wouldn't be able to get tuberculosis. Well, it's a very slim chance. There is a theoretical chance that my tuberculosis will be found in my lungs, even though my chest X-ray is clear. The risk is only about 15%. So for most
15?
intended, 15.
1-5.
Yeah.
That's
so
a very high risk, actually.
it is. It is. So tuberculosis somewhere, tuberculosis elsewhere. This includes the lungs. So once we find one case, Ministry of Health is very strict. They want every single case to be monitored, to be treated. And then if you don't get treatment, they will throw the Infectious Disease Act on you. And you will go into TBCU, TB control unit, and you get compulsory treatment under observation. Open your mouth.
So how
The
does
supervised
this,
one, right?
Yeah.
How does this whole treatment regime go? Because it sounds very draconic. So it must be pretty lengthy process, right?
It is. So this is called DOT, directly observed therapy, where they make sure that the patient takes the drug. And if you don't take the drug, then there's a risk that the germ will turn resistant.
So how many rounds of medication do you need to take?
Like how long generally
How long?
the
Rather you
treatment?
take, usually we go on 4 drugs for 2 months, followed by 6 drugs. Sorry, 4 drugs for 2 months, followed by 2 drugs for 4 months. Yes.
That's a total of 6 months.
That's the total of 6. But that's the shorter course regimen. Sometimes you go for 9 months. And of course, I've looked after patients with TB, tuberculosis, meningitis, where we go on for 1 solid year. Yeah. So it's really, really quite a challenge.
I guess the challenge would be monitoring all the complications of taking the medication for so long.
Correct. So you need to be best friends with a doctor. If something is not right, please come to your friendly neighborhood doctor or your friendly neighborhood infectious disease physician.
This one.
One more thing though, why is Singapore so obsessed? Because in the nearby Southeast Asian countries, you do have multi-drug resistant
Resistant TB.
tuberculosis, where all the first line drugs don't work, second line drugs, well, one
May
or
or may
two
not
may work. And at the end of the day, there may only be 1 or 2 drugs in the arsenal which can treat the tuberculosis.
So you just take that 1 or 2 and then you take it for a long time
Yes.
to try and clear it.
But when you do 1 or 2 drugs, remember we start off with 4
4.
drugs.
I need to
and then
take
2
longer.
drugs. Even if it's just 1 or 2, and if they are weak drugs, the germ can turn resistance against it. So for such individuals, we like at least a minimum of 3 good active agents. And we really need to make sure the patient takes it, because if they don't, then the patient is going to die of tuberculosis. And okay, dying, well, the individual dying, well, it's bad luck. But can you imagine a perpetual problem as she spreads to the
Of
next one,
drug-resistant
and the
tuberculosis.
next one, and the next one? It's like Nightmare on Elm Street. Okay, it goes 4, 5, 6, 7, 8, 9, 10. Never ending.
So we gotta stop it. We gotta stop the bacteria from becoming
Somewhere.
drug resistant at all, right?
Yes. So it's a tall order. Ministry of Health really wants it and they're really very determined. I support it. So if you end up inside the program, do it. It's like I have to sacrifice something. I have to sacrifice for the nation. I have to sacrifice for the good of the people. Do it because by doing so, you are going to help the whole population and even the whole world.
Thank you so much for sharing, Dr. Leong. Is there any last piece of advice that you would like to give our audience? Yeah, things like that.
The answer is infectious diseases sounds very scary, but in truth, we have better armaments in terms of diagnostics, treatment that can actually help control many of these infectious diseases. See a doctor early, get to work with the same doctor, and if the same doctor can't solve it, refer in to a specialist who might be able to help you. Your cooperation with your doctor ensures a faster recovery and in turn, you getting back to your normal life as quickly as possible.
Sounds good. And I think that it's good advice for everything in general, even if it's not infectious disease. If you're feeling unwell, if you're getting some kind of symptoms that you don't know what's going on, it's always good to seek some kind of professional help, get screened, get checked, and get the problem nipped in the bud.
Yes, Dr. Google is very tempting, but sometimes they bring a lot of fear, nonsense, and lead you down the rabbit hole.
So always go and see your doctor, guys, if you have any symptoms.
Yep. Thank you very much for having me on the program.
Thank you for being here. We really learned a lot today. I think many of these infectious diseases, we don't really get to talk about them, and it's always something we see on the news, and it's always good to hear from someone like you.
Thank you.
Thank you.
Thank you. Bye.